Hello, my name is Stacy Kaplan, and I'm going to be presenting a case study for you today about a 45-year-old man with mysterious skin lesions. Our patient is a 45-year-old previously healthy male with a 1-year history of erythematous lesions on his legs, which then spread to his trunk and other extremities. He was born in the United States. He had been to France as a child. He grew up in Florida and is currently living in Florida with spending some time in Georgia. Patient is a carpenter that frequently works outside. His vital signs at the time of his first visit was a blood pressure of 130/75, a heart rate of 72, a temperature of 37 degrees Celsius, and patient does not have any pain. So here are some photographs of the lesions that the patient presented with. You can see that there's subtle hyperpigmented papules are noted on his upper leg with a large hypopigmented anesthetic lesion proximal to his left medial malleolus. He does have intact sensation in his hands and feet. His peripheral nerve examination showed no thickening. A skin biopsy was performed, and it showed numerous acid-fast bacilli, which is indicative of lepromatous leprosy. So what is Hansen's disease? Hansen's disease is an infection caused by acid-fast bacilli. And it's a chronic infection, mostly involving skin and peripheral nervous system. Although mostly found in the southeastern Asia, it is also endemic in parts of the U.S. Southeast. Diagnosis is made based on clinical presentation, confirmed by leprosy, bacilli, and tissue biopsy. According to Gilmore et al., about 90% of the world's population are immune to this bacilli. Incubation time is long-ranging, can last from 3 to 5 years, but there have been cases where it's been more than 30 years. Leprosy has been uncommon in the United States, but the peak incidence was about 1983. According to Buchan et al., between 1984 and 2000, cases diminished, but since then there have been increasing rates of positive Hansen's disease. The number of reported cases has more than doubled in the southeastern states over the last decade. Florida is one of the top reporting states. Central Florida accounts for about 81% of the cases reported and almost 1/5 of the cases nationally. There has been increased incidences without normal risk factors, decreasing diagnoses in foreign-born people. Leprosy is normally transmitted through droplets from the nose and mouth during close and frequent contact. There is a potential for transmission of bacteria from the 9-banded armadillo, and this is believed to be the cause of most of the cases in the southeastern United States. So a clinician may want to consider a diagnosis of leprosy when a patient has a non-responsive skin lesion and is an immigrant from a country with high incidence of leprosy, mostly Southeast Asia. U.S. residences with a history of foreign travel, residents of Texas, Louisiana, and Florida. Here are some cardinal signs of Hansen's disease. Localized skin lesions, raised or flat, light or pigmented, a sensory loss in the lesion, thickened peripheral nerves, demonstrated acid-fast bacilli in lesions. Lab tests, there's no serological culture or insensitivity or skin tests. A skin biopsy is needed for a definitive diagnosis. This is a classification system used mainly in the United States. The forms of is the Ridley-Jopling classification. The WHO classifies the disease based on a number of skin lesions. The system is used when formulating a treatment plan. I really can't handle. Nope. Get the fuck away. Please get away. Please get away. So what are important assessments to perform on a patient with Hansen's disease? A skin assessment, a complete examination in good light looking for hypopigmented or hyperpigmented flat or raised lesions, which may be around the face, ears, trunk, extremities, buttocks, or thighs. Absence of feeling, hair loss, or changes to texture of skin may be present. At first screening, any skin lesion should be examined for light touch and temperature discrimination. With a stainless steel or metal part, skin lesions may be macules, papules, or nodules. There also may be skin lesions, ulcers, tender red nodules, edema around the face, ears, and extremities. Look for loss of eyebrows and eyelashes. In terms of eye screening, Mycobacterium lepi may also cause inflammation and result in scleritis and uveitis. Facial nerve paralysis can also cause damage to the cornea, and this can lead to blindness. Patients with facial lesions may be more prone to facial nerve paralysis, and all Hansen's disease patients should have a visual acuity exam, and any evidence of redness or eye pain should be sent to an ophthalmologist. This can help prevent blindness. Skin symptoms. What to look for, you want to look at discolored or lighter patches of skin, nodules on the skin, thick, stiff, or dry skin, painless ulcers on the soles of the feet, painless swelling or lumps on the face or earlobes, loss of eyebrows or eyelashes. Symptoms caused by nerve damage, numbness of the affected skin areas, muscle weakness or paralysis, especially in the hands and feet, enlarged nerves, usually around the elbows, knees, and side of the neck. So it likes it to have it be cooler, and that's where it attacks. Eye problems may lead to blindness. Some nasal symptoms. So what you're looking for is stuffy noses and nosebleeds. This gentleman's nose shows some damage done to the cartilage that the bacteria have attacked. You can kind of see a slightly enlarged great auricular nerve, and that's very indicative of this Hansen's disease. So a foot screen is also recommended at the time of diagnosis to establish a baseline and on routine basis to monitor for nerve status for early changes. Evaluation includes sensory testing, muscle testing, skin integrity, nerve palpation, and identification of deformity. So this is put together by the National Hansen's Disease Program, which provides teaching to doctors and any places that are trying to learn more about Hansen's disease. A hand screen is also necessary at the time of diagnosis and regular intervals throughout treatment. So next we're going to be talking about the treatment of Hansen's disease. And so this is put together by the WHO, and you'll see that it depends on what type of how many lesions they have. So just to let you know, rifampin is best absorbed on an empty stomach an hour before eating and 2 hours after eating. Urine and other body fluids can turn reddish. Rifampin increases toxicity of alcohol. If ALT and AST labs are more than 2.5 times the normal, please discontinue. Occasionally, it will cause thrombocytopenia. Moxifloxacin is a fluoroquinolone antibiotic, and as such can cause tendinitis, tendon rupture, QT prolongation, and it's a bactericidal antibiotic. Do not take within 2 hours of eating milk-containing products or vitamin supplements and acids. Minocycline is a tetracycline antibiotic. It can cause photosensitivity, so please use sunscreen. Do not take within 2 hours of milk-containing products. Although the patient's nerve symptoms and skin lesions improved on drug treatment, 2 months later, the patient presented with skin nodules illustrated, and he also had swollen joints and a fever. Many Hansen disease patients will have hypersensitivity reaction throughout the course of their disease. Patients who develop reactions have a higher risk of nerve damage. This is the reversal reaction type 1, and you can read the different types of symptoms as well as their treatment. And this is the type 2 reaction, which is a little bit more serious. These reactions are not the result of treatment failing or disease progression, but rather the immune system reacting to dead bacteria. In most cases, long-term prognosis is good. During the prescribed treatment time, all antibiotics are held while the patients are being treated for these type reactions. The treatment of choice for the type 2 reaction, which is what the patient was having, is thalidomide. It is teratogenicity, causing birth defects, and side effects limit its use. It's also difficult to get. Corticosteroids are frequently prescribed, but require such high doses and prolonged therapy that it's difficult to tolerate. Here are a list of what can happen if Hansen's disease is not treated. You've got paralysis and crippling of the hands and feet, shortening of the toes and fingers due to reabsorption, non-healing wounds, blindness, loss of eyebrows, nose disfigurement, painful or tender nerves, and burning sensation of the skin. So what is the outcome for this patient? We've been following this patient for several years. The patient has waxing and waning symptoms with periodic type 2 immune reactions. We will continue to treat him and hopefully he'll get better. I hope you enjoyed a little insight onto Hansen's disease, and I thank you for your time.